So Lester, thanks for coming in and doing this video for me. I really appreciate it. And I chose you as an example with dental implants because of your existing condition before we restored your teeth. And just for our viewers, Lester came in, he had no teeth. He's okay with me sharing that with you. And he went through a very complex dental surgery where he had dental implants placed and he had screwed in fixed teeth that don't come in and out. So the first thing that I want to know, I'm dying to know, is how did you determine it was me that to do your dental work?
Basically, after going through years without going to the dentist, it was throwing a dart. It was finding one that was close to home, something that, or some place where I'd be driving by on a daily basis where I could come in if I had to and still make it to work that day.
So you mentioned after years of not having any teeth, how long did you go without teeth before you?
It had only been 2 years, I think. It was basically, I had lost a tooth, and I just made the decision to have them all taken out and thought dentures would be a wonderful way to go.
And so, which wasn't the case.
Wasn't the case.
That's right. Now I remember you had a set of dentures that you couldn't wear.
Correct.
So what was it about the dentures? Did they gag you? What did they do?
They gagged me. The whole plate on my palate really bothered me. You couldn't feel food in your mouth. You really couldn't taste food at all.
Yeah.
The teeth moved around when you talked, so they were just very uncomfortable.
Yeah, and that's very common with dentures. And so we embarked on a journey together that we're still finishing up. But so you had to make a decision, and one of the things that we hear every day from patients is, what do dental implants cost? How do you afford the dental implants? And you're kind of like an example of someone that chose to spend a lot of money on their mouth. Help me understand why you made the decision to spend $40,000 or $50,000 on your mouth. Tell us about that.
I think if I had had teeth and somebody said, would you spend that much money? I would say no. Going through a year without having teeth, the price was really reasonable.
Yeah. That's amazing. It's amazing that in your mind it was like, it's so important for me to have something there that
It took a couple of weeks to see the final price.
Yeah.
And decide to go with it. But I was kind of generous. I gave myself 30 years more life. Divide that by X amount of meals, and it was actually under $2 per meal.
Isn't that a great analogy? And meals that you can chew.
Yes,
meals that
exactly.
You can chew.
Meals that you can enjoy instead of meals that you just kind of choke down.
Yeah, yeah. So tell me, these are relatively new for you. Mm-hmm. Tell me how your diet has changed. Are you able to eat more of the things that you wanted to eat?
Definitely. My wife and I love to go out to eat, but for a couple of years we only went to like Italian restaurants, something that I wouldn't have to chew and swallow.
And you had no teeth.
No
you were
teeth.
just going in there eating with
Correct.
just your gums.
You basically cut it with a fork and swallow it.
Yeah.
So it's not a pleasant experience.
Yeah.
Now we're out to steakhouses 2 and 3 times a week.
So now you're able to chew pretty much what you want to chew, and as you're getting adjusted to this, and your speech and everything is coming around.
Yep.
So what advice would you give to somebody that maybe was thinking of embarking on that? Maybe it's your age, because it seems to be more your age that are at a point in their life where they can do something to their teeth. What advice would you give them in determining what's best choice for having all your teeth replaced? What would be one piece of advice?
I think would be, don't hesitate. Look at the number, but the number shouldn't be the deciding factor, and I'm sure it wouldn't be for a lot of people. If you're going to do it, just jump in and do it.
There's got to be a bit of a trust here, and you took it. You jumped out on a limb, trusting me, and I really appreciate that. And so thank you so much for sharing your story with us, Lester, and thanks for coming.
You're very welcome.
All right,
Thank you.
very good.